Namaskar, and let's get back to studying Materia Medica, and today we'll be studying about the remedy Ammonium Carbonicum from Dr. N.M. Choudhury's Materia Medica, by the way. So we will be studying it from Dr. N.M. Choudhury's Materia Medica today. Okay, so the first thing he says is that he talks about the constitution of this remedy, which is particularly these people are stout, meaning they are heavily built and they're plethoric women addicted to sedentary habits. So sedentary habits, they mostly have these occupations where they have to sit for a long time and they're constantly tired though doing nothing. So there is fatigue also. They're stout plethoric women and they're tired because and they're doing this sedentary habit. They're having this sedentary occupation. Mentally, these patients are very restless and lethargic. So although they seem to be very tired physically, very stout and plethoric, but mentally they're very restless and also lethargic, and they get more so during a wet stormy weather. So wet stormy weather makes them more of restless and lethargic, their mind. So that's the basic idea about constitution. Further, Dr. N.M. Chaudhary tells us about its action on blood, on mucus. So action on blood is basically more of the crude material acting on blood, ammonium carb as a crude material acting on blood. And we also have its action on mucous membranes as a remedy. What does it cure? Acting on mucous membranes, we have mucous membranes in nose, throat. He also talks about the cough of this remedy, and also its action on female reproductive organs, which is a very important area sphere of action of this remedy, and then also on the skin and few other conditions. So that's how we also will study this remedy, just like as Dr. N.M. Chaudhary has written it in his Materia Medica. These all notes are made from his Materia Medica itself, and there's nothing that has been added by my side. And let's understand what Dr. N.M. Chaudhary explains to us about the remedy ammonium carb. So the first thing he does is he tells us about its action on blood. So Dr. Ammon Choudhury says that this remedy has a strong action on blood and generally leads to the dissolution of RBCs due to poor oxygenation. Now, what happens when there is poor oxygenation, when the RBCs are getting dissoluted? So we see that there is necrosis which sets in. So due to that, we also see gangrenous ulcerations in these patients. And there's also flabbiness of muscles, spongy consistency of the gums, and other similar changes of the tissue, which we will very commonly find in this remedy. Because the pathogenesis of the remedy is that it acts on the blood and it leads to the dissolution of RBCs due to poor oxygenation. Now, due to the degeneration of this blood tissue, the hemorrhage which is seen in this, so the hemorrhage is seen in this remedy will be dark, strumous, and clotted blood. So we will not most often find bright color blood and bright color thin watery blood in this remedy, but more of dark clotted blood because there is poor oxygenation. So the blood will be having more of carbon dioxide and less of oxygen, giving it more of dark shades, dark color. So dark strumous clotted blood will be there in this remedy. This is how Dr. N.M. Chaudhary first explains to us the pathogenesis of the remedy. And then he also tells us that they are, due to the same reason, constantly chilly, averse to fresh and open air. Washing, wet applications, cold weather, all of these things aggravate all their complaints. So they are very chilly, they're constantly chilly, they do not want fresh and open air, even any kind of thing that a chilly person does not want. So they do not want to be washed, they do not like wet applications or cold weather, nothing like that. So now he also tells us that there is carbolic acid poisoning of blood. And this carbolic acid poisoning of blood, in which again the blood is affected, the symptoms that are found are such. There is peculiar ashy paleness of the lips, shortness of breath, and palpitation after every excitement, which are very characteristic in this kind of a situation when the blood is affected and we see this kind of symptoms. So that's the whole point that he talks about first, telling us about the pathogenesis that this remedy has on blood. So now talking about the action of this remedy on mucous membranes, especially very importantly on nose, we see that Dr. N.M. Choudhuri writes that this is an important remedy in nasal catarrh, and Dr. N.M. Choudhuri says that we particularly think of it in coryza in hysterical females. Now let's go to the most characteristic symptom that these patients have. They have stoppage of nose mostly at night time. So we see this lady who has this nose block, and she is using a nasal spray for the obstruction. So how can we with homeopathy help them and reduce the usage of, or even avoid the usage of nasal sprays? So ammonium carb is one such weapon, one such remedy that helps us do this. But the indications should match. If we have the same indications that Materia Medica talks about ammonium carb in our patient also, then we can obviously and surely help this patient with ammonium carb. So most characteristic symptom is a stoppage of nose, which is mostly seen at night times, which is very important. So mostly at night times the patient must open his mouth and breathe through it, as if breathing through the nose is apparently impossible, and hence it is such an important remedy also in the snuffles of children. So even children have nose blocks and they have to breathe through the mouth, and it creates a kind of sound, and we call it snuffles of children. So even in that situation we can again prescribe this remedy if the indications match. Now another symptom which is very important also is that they're constantly subject to a sensation of oppressive fullness near the bridge of the nose, as if everything inside would burst. So this is the root, or the also called as the bridge of the nose. So this is the root of the nose, the bridge of the nose, and at this point, at this in this region, they feel kind of oppressive fullness, as if everything would just burst, everything inside would just burst. Okay, and even when they have the head troubles, they're more of more located in this region only, and they also include the forehead. So we find this as the region of this remedy. Okay, so all the head troubles are particularly located in this region. The headache may be pulsating, beating, pressing, but it is always located in the forehead. So we find this area to be affected in this patient. So what did we see under nose? We found that this remedy is a very important remedy for nose blocks, especially at night. We found out that at the root of the nose they have this kind of oppressive fullness. They also have it in forehead. They also have some pain in forehead, and or even all the head troubles are some in particularly located to this region only. Moving on to the throat symptoms of this remedy, we find that in this remedy actually not just ordinary sore throat can be seen or can be helped with this remedy, but we also see that putrid sore throat is also something that this remedy can help us in. Okay, so putrid sore throat meaning more where ulceration is involved, gangrene is involved, that kind of sore throat, which can also be seen in scarlatina, in diphtheria. So in these patients they have tonsillitis also. So these are the tonsils, and they get, when they get inflamed, we call it tonsillitis. And when tonsils get very very enlarged, okay, they can narrow down the throat, and for actually the entry into the throat, and lead to a little bit of breathing issues. Okay, so they get enlarged when they're highly inflamed, and they also look almost bluish in ammonium carb. The gangrenous ulceration of tonsils as well. Now again, because of all these things and stoppage of nostrils, they frequently wake up. It again leads to great uneasiness and discomfort, and there's also engorgement of cervical lymphatics as well as parotid glands. So even the cervical lymph and parotid glands get engorged with this tonsillitis, and the sensation of great burning is from alcohol in throat and the in esophagus. Now another remedy that actually comes near to this picture is lachesis, as Dr. N.M. Choudhuri points out. So the tonsils are looking bluish, there is ulceration. So all these things may lead us to think of lachesis also, but Dr. N.M. Choudhuri tells that lachesis, which is characteristically left-sided, but ammonium carb can be right-sided, and lachesis has this sensitiveness which is lacking in ammonium carb. So that's how we see the throat symptoms in this remedy. It's very easy. They are inflamed, they're bluish, they're gangrenous ulceration also, and stoppage of nostrils, etc. Now going on to talk about the cough of this remedy, we find that this remedy has a kind of dry and tickling cough. Along with that, they have hoarseness, which again which points out to the larynx being affected, leading to this hoarseness indirectly. So larynx is involved, and that leads to this hoarseness. In the larynx, the patients feel as if there's tickling as from a feather, and also they feel that in the throat, so they feel that there is a feather which is tickling, and that is why they getting this cough. And there can also be accumulation of a lot of mucus in chest, leading to oppression, asthmatic cough, rattling, and as in emphysema. And Dr. M. Choudhary over here also tells us that these patients, this remedy can even cure emphysema, again if the indications are there. Now the cough is always aggravated at 3 a.m. in the morning, is an again important symptom. So again 3 a.m. again it's right when you are sleeping. Even the nose block was when at night you are sleeping. So at night the nose block was again getting affected, and even the cough is there at night, especially at 3 a.m. Moving on to talk about the action on the female reproductive system that this remedy has. So Dr. N.M. Choudhary tells us that ammonium carb is indeed a capital remedy. So indeed a capital remedy in many of the affections of females pertaining to those organs. So that gives us an idea of the importance of this remedy and its action on female reproductive organs. Now he says that there is hysteria due to too unnatural excitement of the sexual organs, especially of the clitoris. So there is too much excitement of the sexual organs, which leads to hysteria. Uh, then he tells us that even if the discharges that come out through the uterus, the menstrual blood may be there, or the leukorrhea, both are excoriating. Both are very acidic and very excoriating. The menstrual blood is although is it looks black and clotted, but it is excoriating. The leukorrhea is also excoriating, and we find that the leukorrhea is profuse, and there is irritation, itching, burning, and swelling of pudenda, leading because of this excoriating leukorrhea, and also ulceration in vulva. And menstrual blood makes this thighs so sore because of their excoriating nature. So this is something that we need to remember, the excoriation that is caused due to the menstrual blood and also the leukorrhea, which finally leads to many symptoms also. Next, Dr. N.M. Choudhary very beautifully tells us what happens during menses in these patients. So these patients suffer from all sorts of aches and pains, particularly toothache and colic during menses. Okay, they have all sorts of aches and pains, particularly they can be toothache and colic. There's exhaustion, there's great fatigue, especially of the thighs. Again, thighs are coming into the picture. They yawn and stretch with chilliness. And just at the commencement of menses, when the menses are just starting or they've just started, we see that they have cholera like diarrhea and ammonium carb. So that's also a few symptoms related to the female reproductive organs. So what did we see in female reproductive organs is that first there is hysteria due to unnatural excitement, a lot of excitement that happens in the sexual organs. And then again we see that the menstrual blood, which is black and clotted, and the leukorrhea, both are excoriating. And since they are excoriating, the menstrual blood can make the thighs sore, the skin over there sore. And the leukorrhea, which is also profuse along with being excoriating, it causes itching, irritation, burning, it leads to swelling of the pudenda and ulceration in the vulva. We saw what happens during menses. They have all sorts of aches and pains, particularly toothache and colic, and they have this great fatigue also. And during the commencement, just at the commencement, they have this cholera like diarrhea. Then finally, the last point is the action on the skin that this remedy has. So this remedy is used extensively in Whitlow and Panericium, which is again a situation, a condition in which the finger is inflamed, and there is kind of inflammation. Even there can be pus formation that we find. And Whitlow is again there is herpetic Whitlow also, where there is an eruption around the finger. So we see that if the finger is extremely inflamed, obviously in all cases of Whitlow Panericium, but there's deep-seated periosteal pain is also felt and there are red streaks which run up to the axilla from the inflamed area. Inflammation and pain in the ball of the great toe. So if this happens in the great toe also, then which looks red and swollen. Now there can also be malignant scarlatina. What is malignant scarlatina is nothing but a group A streptococcal infection that happens. So when that happens, they can have rashes. Along with that, they can have putrid sore throat, meaning all the ulceration in the tonsils will also be there. Somnolescence, meaning very much they're very sleepy. Palpitation, parotiditis, involuntary defecation, and stertorous breathing. So all these can also be seen, and this is how it acts on skin. A little bit that Dr. N.M. Choudhary has written is what we're discussing. So today we've discussed the remedy ammonium carb, and what all did we discuss? Let's revise very fast. So first we talked about its action on blood, right? First we talked about its action on blood, where we saw the pathogenesis that this remedy produces, and we saw that this remedy acts on the blood and leads to the degeneration or the dissolution of RBCs, and because there is poor oxygenation that we find, and finally that leads to gangrenous ulcerations, flabbiness of muscles, etc. That is how it acts on the blood, and this remedy, in the same way, in potentized form, will cure this type of conditions. And action on mucous membranes we saw in the nose, throat. So we've seen very important action on the nose, especially the nose block, the fullness at the root and the bridge of the nose. Yeah, the pain in the forehead, we saw that in the throat it acts and cures tonsillitis, the breathing issues. Along with that, there can be cervical lymphatics also involved, etc. We saw in the cough that there's dry tickling cough. Along with that, there's hoarseness, since larynx can be involved. There's tickling as from a feather in larynx, there's accumulation of mucus in chest also, and the cough was especially at 3 a.m. in the morning. Then we went on to talk about the female reproductive related symptoms, in which we saw again the hysteria. Then we saw how the discharges are very much excoriating, and that is why the further symptoms are produced because of the excoriating nature of the discharges, the leukorrhea, the menstrual blood. We also talked about the symptoms that they have during menses, and at the commencement of menses they do have diarrhea as well. And finally we talked about the skin conditions, the vitiligo and panaretium, in which again this remedy is also indicated. So this was ammonium carb from Dr. N.M. Choudhury's Materia Medica, and I hope we all learnt a lot, and we must go back and read this remedy from the different Materia Medicas as well, another different other Materia Medicas as well. Thank you.